Good morning. I'm Dr. Melissa O'Reilly, and we're here with Miss Peggy-Sue today. She is actually our clinic cat here at Longview Animal Hospital, but she's due for her annual wellness exam. So what we're going to do is we're going to go through her physical and let you guys know what we look at every time we do a physical on your animal. Peggy-Sue, she's a short-haired cat. She's spayed, and she's about 2 years old. Prior history for Peggy, she came in from animal control and had a injured leg. So about 2 years ago, Dr. Foy removed her leg, and she's happy and healthy now. But that's also something we'll go through as part of her physical exam, take a note on how she's doing since that visit. Since Peggy-Sue is our clinic animal, she has a prior history with us. We take regular notes on her care, and we can track her progression and see any changes as far as her weight, her coat health, as well as her dental health, and anything else that might change between her first visit here in 2016 and then today in February of 2018. So to start with Peggy, I like to start with the head and move back to the tail. So the first part of our exam, we look in the ears, and what I'm checking for is any evidence of ear mites or other infection, any kind of ear wax that might be there. We do have our fancy otoscope that lets us look down in the ear just like you would at your ear doctor. And so I can actually put this down in her ear and see all the way into her ear canal. It lets me check those membranes, make sure that her eardrums are all okay, and that there's no evidence of either wax or ticks or other parasites that might be living in her ears. Peggy's ears look beautiful, so we're going to move to her eyes. So when we're looking at the eyes, I'm looking for overall health. Are they red? Is there any clouding? Does she have any discharge or goop at the corner of her eyes? And her eyes look clear. Her pupils are normal. Her irises are a good color, and her conjunctiva is nice and white. So again, I'm going to take my ophthalmoscope and take a look in her eye. And this gives me a closer look that the naked eye alone can't see. So with this, I can actually see to the back of her eye. And her retina looks healthy, and all the blood vessels back there look healthy. Her pupils are nice and dilated, so all of that is normal. And her eyes look good. So from here, we'll move on to her mouth. And with this, we're looking for a couple of things. So when I check inside her mouth, I'm looking to see her gum color. Is she nice and pink, or does she have any evidence of dehydration, any sign of infection that might be going on? The gums will change color based on the animal's health. Purple is a bad sign. That's typically a sign of shock or severe infection. The same thing with red. If the mucous membranes are red, that usually indicates that there's something else going on with those teeth that we need to be aware of. So Peggy's mouth looks pretty good. She's resisting just a little bit, but that's okay. Her teeth look nice and clean, but I can see some little tiny microfractures here on those big canine teeth that don't appear to be causing her any trouble, but that's something we'll make a note of in her chart to track that as she ages. So one thing we look for in the mouth, the most common thing is periodontal disease. Being that this is February, it is dental month, so we are doing more as far as education on what's going on in the mouth. Things we look for is tartar on the teeth. Our pets can't brush their teeth themselves, so it's up to us to either brush their teeth or offer them some dental chews to keep the plaque down to prevent that tartar formation. If the tartar formation gets bad enough, it can progress to true periodontal disease where the gums start to become infected, the teeth themselves can get infected, the roots can become diseased, and those teeth can actually become loose and fall out. The importance of that is that if that disease progresses enough, it can actually translate to the heart, the kidneys, the liver, and cause infection there. It can even contribute to heart murmurs if she were to get an infection on the valves of her heart. So all important things for us to be looking for. Peggy's mouth overall looks good, so we're going to move on to the rest of the exam. I'm palpating her neck here to feel for her lymph nodes, make sure there's no inflammation there. In cats, it's also important to check the thyroid. Some cats will get what's called hyperthyroidism, and that thyroid will become enlarged, and that can have significant health effects as far as their weight and as far as their metabolism. So it's important, especially in a cat, that we check that out. So now I'm moving on to the rest of her body. I'm feeling lightly at first on her chest and on her belly. And as I go, I'm pressing just a little bit harder each time. What I'm feeling for is her organs inside of her body, whether any of them feel large or abnormal. It's also letting me get a good assessment of her body condition score. Peggy here, she's in pretty good body condition. Our body condition chart ranges from a 1 to a 9, with a 1 being your ASPCA emaciated cat or dog, and a 9 being your coffee table dog or cat, the ones that are super fat. So Peggy here, she's about a 5 to a 6, which is where we want them to be. She's a little bit on the chubbier side, so she could probably stand to lose a couple ounces here, but overall she looks good. I can feel all of her organs. Her spleen feels normal. I can't feel her liver, which is good. And all of her intestines inside feel good. She's not giving me any indication of pain in her abdomen, which is also a good sign. Some animals that have an upset stomach or an impaction, they'll oftentimes have abdominal pain and they'll react when pressing on their abdomen. So we move to the back, and I'm checking her back legs. There's some lymph nodes right here behind her leg I check, making sure her pulses in her legs are normal and that the blood is flowing well back here. And all of that feels good. So the next part is to take a listen. And what I'm listening for is the heart, whether the beat is normal and the rhythm is normal, as well as whether or not there's any sort of murmur there. While I'm listening, I'm also listening to her lungs for any evidence of crackles, wheezes, or other unusual noises. The presence of any of those sounds can denote things like early pneumonia in cats. Asthma is a main concern. And then other presentations such as bronchitis are also not uncommon. So even though Peggy here has been happy and healthy, it's still something that we take a listen to. We make a note in her chart. And even if everything is normal, if she ever does become sick or at her next physical, if something has changed, we can look back and track that progress. And on this physical exam, you'll note it's very important we check both sides of the cat, because sometimes the left will sound different from the right. Okay. Peggy sounds great. She does not have a murmur, and her lungs sound perfect and clear. And so that is the bulk of our physical exam. The next part on her, since she is missing a leg, we do take some special attention to that area, make sure she doesn't have any pain from that prior surgery, and that the other leg is also doing okay. With Peggy missing a front leg, that means she has to bear more weight on the present front leg. And so it's important to make sure she's not starting to develop any arthritis or pain from having to bear a little extra weight in that area. So what I'll do is I'll palpate this shoulder here. And as you can see, she seems to be pretty comfortable, so that's good. And the next thing I'll do is I'll move down this leg and feel her good leg, this good left front leg here, and make sure all those joints feel okay and that she's not feeling in pain from that. And as you can see, everything looks good. The last part of our physical, we're going to go ahead and take Peggy's temperature and make sure that all checks out normally. And her temperature is normal. Her temperature is 101.3. Normal in a cat is actually significantly higher than in people. For cats, your normals range between about 101 to 102.5. So she's perfectly in the range of normal. Overall, Peggy's physical exam looked good. To recap, she had a couple little fractures there on her teeth that we will make note of, but her heart and lungs sound good, her eyes and ears are clear, and she looks happy and healthy and ready to get her vaccines that she's here for today. Peggy is our clinic cat, so for her, it's important for us to factor in that exposure that she gets to other cats that we have come here and board to protect both her and the other cats that we have here coming in and out of the clinic. So what she's due for today, she'll get her rabies vaccine, which is required by law. She will also get her FBRCP vaccine, which vaccinates for any upper respiratory diseases that can make her cough, can make her sneeze, that would be infectious to other cats as well. And she will also get her feline leukemia vaccine. That leukemia vaccine is very important for cats that live in a multi-cat household or that are going indoors and outdoors, as they're going to be at higher risk of exposure. The leukemia can actually be spread from cats grooming each other. It can also be spread from sharing food and water bowl sources. So minor transmission of that is very important, and so we protect them against it. Once she gets those vaccines, she'll be happy and good to go for another year, and that's it for Peggy today.